All right, let's talk rippling. So for you visual learners, here is a great example of what rippling looks like. So when this patient leans over to the side, you can see these lines right here. And these are the lines you get from an implant when you get folds in it, just like that. So first of all, every single implant ripples. Some of them ripple less than others, but they all ripple, and that's just because they're soft. These are intended to be placed on the curved surface of your chest wall. And when they're on a curved surface like that, you just don't see as much of that rippling. Now, when you're not on that curved surface, like when you're bending over, your implant goes like this and you can see more rippling. So the places patients see it the most are going to be on the sides. There tends to be less tissue, especially if you're dual plane or under the muscle. And then up here in the cleavage line, when you bend over, you can see it as well. Now, the final type of rippling that I will mention is something called traction rippling, where the implant adheres to your tissue, and then when it gets pulled, you can end up getting rippling just from the traction. So all of these things can be improved by doing a variety of things. So the first thing we always consider is, of course, how much tissue do you have over the implant? Can we hide the rippling better? And is there an implant that ripples less that we can replace your implant with? So if you don't have a lot of tissue over your implant, you can consider something like fat grafting or even placing the implant under the muscle, which will give you a little bit of that muscle tissue over the implant to hide the rippling. Now, changing the implant can also be helpful. So if an implant is very soft, it ripples more. The firmer, more cohesive implants ripple less. So switching you to a different type of implant may be helpful. And then I'll finally add that some people will do things like put dermal matrix over the implant and try to add a little tissue that way. I don't think that works very well. Wouldn't recommend it, very expensive. But it certainly is an option, and some surgeons get good results with it. So rippling is a super annoying complication of surgery. It's always important to understand, though, if you are a thin patient, whether you're under the muscle, over the muscle, whatever, when you get in weird positions and contort your body, you're probably going to see some rippling.